Good evening, everyone. Thank you for providing this wonderful opportunity for allowing me to present my research in this 10th National Summit organized by Nepal Health Research Council. My research topic is decomposing inequality in knowledge about HIV prevention and discriminatory attitude towards people living with HIV among youth aged 15 to 24 years in Nepal. Young people, they are at a higher risk of having HIV due to their risky behaviors. And knowledge about HIV prevention is essential to enable them to avoid HIV infections. The stigma and the discrimination related to HIV, it can hamper the HIV testing, prevention, and care efforts that can affect both people living with HIV and those who are at risk of having HIV. And a study in Ethiopia have shown that the knowledge related to HIV prevention, it is more concentrated towards rich people compared to poor. The inequalities in HIV prevention knowledge and discriminatory attitudes towards people living with HIV, it can ruin the government's effort to reduce HIV stigma. And it can also ruin the government's effort to achieve universal access to HIV care and treatment. In this setting, in order to find what is the situation in context of Nepal, we aim to assess the socioeconomic inequalities in HIV prevention knowledge and discriminatory attitudes towards people living with HIV among youths. And in the next objective of our study is to measure and decompose the inequality differential in HIV prevention knowledge and discriminatory attitudes between different years. Talking about the methodology, we have conducted secondary analysis from Nepal Demographic and Health Survey from 3 consecutive years, 2011, 16, and 2022. In our study, the independent variables involves age, sex, place of residence, ecological belt, ethnicity, religion, marital status, wealth, media exposure, and ever tested for HIV. And our dependent variables include HIV prevention knowledge. It is HIV prevention knowledge and discriminatory attitudes towards people living with HIV. And they are the composite indicators. We have calculated them in a binary form using different multiple questions, creating composite variables. Talking about the statistical analysis, we have performed weighted analysis, and we performed wealth-related inequality using the concentration index and using the concentration curves. And decomposition analysis was carried out using walk-step method, and we applied Osaka blinder decomposition method in order to measure and decompose the inequality differential between 2 different time periods. And we use R software and different packages within R for those statistical analysis. And for this statistical analysis, because it is totally new to me, we have explored methods from the several different papers, and we have consulted with some experts and conducted this analysis. Now let's come to the results section. In all 3 consecutive years of NDHS, the male and females, they were distributed in 1:3 ratio. Talking about the age, the distribution was nearly equal between less than 20 years and 20 to 24 years. And now the result part is the knowledge, the proportion of the youth with HIV prevention knowledge, it has decreased from 27.8% in 2011 to 18.8% in 2022. And this decrease in knowledge is seen in both males and females. And on the other hand, the discriminatory attitude towards people living with HIV, it has increased from 37.2 in 2016 to 52.4 in 2022. And this trend is similar in both the males and females. Here, while looking over the distribution of knowledge on HIV prevention and discriminatory attitude towards people living with HIV by wealth quintile, we have seen that in each survey year, there is a substantial gap between richest and poorest wealth quintile group. And if we see over the trend, the proportion of the youth with knowledge on HIV prevention, it has increased from 10.2 in 2011 to 14.6 in 2022. And among the richest, it has decreased from 48.8% to 31.5%. And if we talk about the discriminatory attitude towards PLHIV by wealth quintile, it has decreased in both wealth quintile poorest and richest wealth quintile. And there is a gap between poorest and the richest wealth quintile. And we have plotted the concentration curve. Here, the concentration curve consists of the diagonal line, black color diagonal line. It is a line of the equality. And if the concentration curve lies below the line of equality, then the problem is concentrated towards the richer group. And if the concentration curve lies above the line of equality, then it is more concentrated towards the poor. Here, from the figure, we can see that in 2011, the knowledge on HIV prevention, it is more concentrated in all the years. It is more concentrated towards the. In 2011, the knowledge on HIV prevention, it is more concentrated towards the richer group, whereas the discriminatory attitude, in 2016 and 2022, it is more concentrated towards the poor. And the concentration index for the HIV prevention knowledge has decreased from 0.288 in 2011 to 0.176 in 2022, whereas for discriminatory attitude, it has increased from minus 0.131 in 2016 to minus 0.079 in 2022. It indicates that there is overall reduction in the inequality. And if you see the decomposition analysis of concentration index in NDHS 2022, in both knowledge on HIV prevention and discriminatory attitudes toward people living with HIV, the inequality, the major drivers for the inequality, they are wealth and the education. And if we compare between, if we see from the Osaka Blinder decomposition, if we see the change in inequality, the major contributors for change in inequality in comprehensive knowledge on HIV prevention and discriminatory attitude, the major contributors are same education and the wealth. And for the discriminatory attitude, the type of occupation they are engaged in, that is also the major contributor. And in the conclusion, we have seen that the proportion of youth with HIV prevention knowledge has decreased, while those with the discriminatory attitude has increased. And the inequality in HIV prevention knowledge between 2011 to 22 and discriminatory attitude between 2016 and 2022 among youth has reduced, with the wealth and the education as the major contributing factors. Providing community-based HIV testing and counseling services that incorporate behavior change and HIV prevention communication could be a game changer to enhance knowledge and positive attitude towards people living with HIV. And the government should work collectively with schools and communities to design HIV-related educational interventions for youth and integrate them in the course curriculum. And with this, I'd like to end my presentation, and thank you.